Hi, my name is Dr. Rubin. I'm a board-certified allergist. If you experience an itchy, scratchy throat consistently after consuming peanut butter or other nut butters, then it could potentially be an oral allergy or an IgE-mediated food allergy. So what do I mean by that? Oral allergy syndrome is when your immune system is confused and thinks that certain fresh fruits, vegetables, or even nuts have similar protein structures to certain pollen grains from trees, grasses, and weeds. Birch tree pollen is one of the most classic examples of this. So your immune system will start an abnormal immune response where it creates a little bit of itching, a little bit of minor swelling that's localized to the mouth or throat. And if you cook, can, process, or do anything that could potentially change the protein structure of that food, the immune system won't get confused anymore and you won't have symptoms. It is rare for that to progress to a severe allergic reaction, but it is theoretically possible. On the other hand, an IgE-mediated food allergy, one that you would get a positive skin and or blood test to, is when your immune system gets confused and thinks that the particular food is like a parasite and will create these specific antibodies. They're like protein tags called immunoglobulin E, or IgE for short. That process is called sensitization, and then upon subsequent exposure to that food, your immune system will go through a process that is an allergic reaction mediated by something called a mast cell or mast cell activation. They'll release chemicals like histamine and other things like tryptase, and it could be either a mild reaction like itching, a little bit of swelling or hives. It could be a little bit of an upset stomach, vomiting. You could end up developing anaphylaxis where you could have problems breathing like wheezing or throat closure. You could have a combination of symptoms from multiple body parts. You could even progress towards anaphylactic shock where your blood pressure drops, blood leaves your vital organs, and you could develop a heart attack, stroke, or even potentially pass away from this in rare instances. Therefore, if you consume any type of nut butter and experience something like this, because it's a little bit higher risk of potentially developing an IgE-mediated food allergy, you should be talking with an allergist to have a formal evaluation to differentiate between the two issues and determining your risk for having a severe reaction.